Hello and welcome to episode 16 of the Dental Realist podcast. I am Dr. Ryder Waldron, and we appreciate all of our returning listeners and our new listeners tuning in to listen to us tonight. And the Dental Realist podcast, we're here to give you some honest insight, honest opinions. We're actual dentists giving these opinions, and we just really appreciate all the support we've gotten from all of our listeners. And first, let me introduce my friends and co-hosts, Dr. Marcus D. Neff and Dr. Troy Stevens. Marcus, how's it going tonight?
It's going great. I enjoyed a great week of dentistry, and I'm fired up for the podcast. How's that?
One of those statements is true.
Yes.
He's fired
Troy,
up
what about
podcast.
you? How's it going?
Yeah, I'm doing great. Thanks. We had a good long week, and I'm glad that we can finally relax and talk about some real stuff.
Yeah, it sure feels like it's been a long week, and if anyone's listening to us on a Thursday, then you know exactly how we feel.
Thursday afternoon.
Unless you're one of those sorry souls that likes to work Fridays and
Saturdays.
Yes. Mm-hmm. I don't know.
Hopefully, if you are at work on a Friday or Saturday, we can be your moral support, your shoulder to cry on.
Yes.
Listen to us on a weekend.
That's right. Relax with us on a weekend.
That's right.
We'll laugh together. We'll cry together.
We definitely won't be doing dentistry today.
We won't do any dentistry together?
Any dentistry on the weekend.
No.
That's right.
No.
Of course. Catch me doing that, you know what I'm saying?
Well, tonight we've got a great topic. We're going to talk about mental gymnastics, or dental mental gymnastics, I guess, as it is. Marcus, do you want to tell everybody why we chose this topic, what happened at your office to kind of drum up this topic for us?
Yeah, I don't exactly remember what it was, but we were all texting back and forth, and I had a patient that, oh my gosh, I had to go through so many different thought processes and talk myself in my mind into doing this or saying that, and by the time you're done, you feel like a gymnast, like you've been out doing some kind of a floor exercise, jumping and spinning and twisting and doing all sorts of crazy maneuvers just to get yourself through whatever it is you're doing with the patient. And I feel like I did a lot of mental gymnastics this week.
Yeah, amen. Yeah, and we've all talked about at the end of a day of dentistry, we're more worn out mentally than we are physically. And sometimes it is just up and down all day long.
Ain't that the truth?
Well, isn't it, though? Especially when you're, depending on how your day is, how many patients you see, how many different, personalities and stuff you go through in one day. It's like, wow.
Yeah. Yep.
It's true, yeah. Your personality or, the dentist's personality has to change for every patient, and their personality is just, the same, each patient. Yep. But, yeah,
Wears you out.
It really does. Well, so we're going to go through a few different patient types, I guess, tonight, a few different scenarios that we've had in our offices, and I'm sure most dental students, most practicing dentists have had probably all of these at one point. And if you haven't, well, bear down because you're going to.
Yep, absolutely. Some of the dilemmas and trials we have every day.
Let's start. I think this one's pretty fresh. So why don't we start with the patients that refuse x-rays? I know was it a year or two ago, something on like ABC News came out and said that, dental x-rays are like the, worst thing ever, and they're going to make you glow in the dark, and they're poison and this and that. And I had a string of
brain cancer.
Yeah. I had a string of patients after that came in, and they didn't want x-rays mostly because they heard that. But what do you guys say when they come in and they say, I don't want x-rays for whatever reason?
You want me to tell you what happened to me today with that?
I do want you to, yes. Okay,
yeah, we had a gentleman come in, and wanted a comp exam, wanted to know everything that's going on with his teeth, and refused x-rays, so we excused him from the office.
and I think that's the right thing to do. I mean, honestly.
But that sounds harsh. And if that would have been the first couple years of dental school, coming out of dental school, I would have gone crazy. You don't want to lose a patient. You want your chairs full and stuff like that. But how many times, and you guys have all been to those risk management seminars, those people who they can decline treatment, but they cannot decline diagnostics, because that's our responsibility to be able to tell them what they're doing. X-rays are a diagnostic tool, so if they reject those, we have to kick them out of the office. We have to.
And that's tough because I think back to my early years right out of dental school, a lot of my patients were older than me, so it's kind of tough because you feel like it's hard to talk to somebody that's older than you and tell them, what they are and aren't going to get or aren't going to have you do in their office. And so that can be tough, just having people that are older than you. But it's also tough, like you said, these are people you want patients in your office. You're always trying to get new patients and retain the patients you have. So you're tempted to just appease them and just say, oh, okay, and go along with it. But you're really opening yourself up to a lot of liability.
Yeah, that's a good point, Mark, because I never thought of that, respecting your elders. And that's it feels difficult to kind of tell older people or people older than you that they need this and have to have it. And that's a good point. I don't think I ever thought of it like that.
One of the challenges on stuff like that too, and the whole thing, reason we're talking about this in mental gymnastics is because in your mind you're going, I want to do what the patient wants me to do, but I have to do what my license tells me I have to do, and that's diagnose stuff. And if I can't diagnose it, I can't. And so you get in this really crazy dynamic, and it's brutal. But you can't see those people.
Yeah,
and it's hard to excuse someone from your office when they, you don't want to just say, well, I know it's your money, and I know, it's like when you go into a car dealership, they say, I'm going to buy this car. Well, yeah, you can buy whatever car you want, but in dentistry, you have to have a certain amount of, information that you can give them to show them what they need for their mouth, and it's a crazy dynamic.
Yeah, that's true, and I had kind of a similar situation a few years ago. I had a lady that came in and she hadn't been in for, I don't know, a couple of years or something. So my hygienist asked her to fill out a new health history, and she just said, no, nothing's changed. I'm fine. I'm healthy. I'm fine. And so my hygienist said, okay, well, if you don't have any of the, anything that's listed on the health history, can you just sign here and say that you've read through it and, you don't have any? No, I'm not going to do that. And so she was like total, my hygienist didn't know what to do. So she came and got me, and I asked her, the patient, what's the problem? I'm just not going to do this. I don't know why I have to fill this out. I explained, well, it's, to protect you, basically. We can't do anything. If, you have some health condition that we're not aware of, then you're putting yourself at risk. And she just, okay, fine, give me that and I'll sign it. And I said, okay, I'll be back in to do your exam and everything. Well, in the time that I walked out of the room, she had decided apparently that she wasn't going to, do that. And she just got up and left. And I had told her that if she doesn't, fill it out, then she's going to have to leave. And that's when I'll just fill it out. But anyway, so what do you guys think? Is there a way to convince people or explain to people that don't want these x-rays that they are important? What's your go-to methods?
Boy, I don't know if I have like a go-to. I think, we try to just explain to them, there's all the different things you can say. Well, you get more radiation, riding in an airplane, all that kind of stuff. But I think some people just have their mind made up, But I think you have to try. You have to at least try to explain something to them to say, hey, we need to have these x-rays. There's safety. I don't know. You could maybe find some ADA study or something like that you could point to, but I don't know if that would even convince some people.
Yeah, there's some people that just have their mind made up, and you can't convince them. It's not like you try and sell. I hate that term, sell dentistry, but you're not trying to sell anything because you're just trying to diagnose something. But I always tell them, I don't have the ability to see between your teeth, and therefore I can't tell you if you have a cavity or not. So, and if I can't diagnose anything and can't see it properly, then I can't treat you.
Yeah.
So that's their decision, say, hey, you want me to take the x-rays and we can tell you yes or no that there is something between your teeth or no, or the bone height, we can do a perioprobe and stuff to kind of determine bone height, things like that. But a lot of things you see on the x-ray that you just wouldn't see otherwise. And pathology as well. Yeah. That you never know is there.
And I think if you ever even think you want to see a patient like that and still see them even though they refuse x-rays, you dang well better have some kind of a form that they sign that describes that they declined the service and you can't properly diagnose. And even then, I wouldn't recommend it. You're still opening yourself up to risk, but at a minimum, at least have something like that.
Yeah, that's when you call your malpractice insurance and ask them their opinion. And I'm guessing just about everyone will say dismiss that patient from your practice.
Yeah.
Yep. In the risk management seminars, they say that. They say, you cannot see the patients that decline diagnostic.
Yeah.
So, and it's the same thing with the paperwork. I mean, on the other hand, who wants a patient like that? Because, even if you did take x-rays on a patient that you had to somehow convince that they needed them and they go, okay, fine. Then you tell them they got 3, 4, 5 cavities. Oh my gosh, you guys are just pathetic. How many times do you hear that? It's like, yeah, I just made them up, dude. And you get a situation where that patient is going to be a pain in your know-what forever. So, it's not bad to let those folks go.
It's not.
It's another one of those headaches you don't have to deal with.
That's true. And, this kind of transitions to another patient, the know-it-all patient that knows more than you as the dentist. And a lot of these patients have read stuff online. They, whatever, recently there was that study about that flossing's not important. Well, okay, I guess if the news says it, it must be true. And, why would we recommend flossing if it wasn't important?
Wiping your butt, you don't have to do that either. But, I mean, it's advised. I don't think there's a scientific study out there, but,
No, I don't know.
It's advised. I like that. Advised that you do it.
But
that's perfectly
true,
though. So true. You get those patients that come in and they tell you all the stuff that they know, and when you tell them they need this, and they tell you, no, I don't, because I read something on the internet that I need this instead of that, and you try to explain, no, the reason you need this is because of that. They don't get it. Those folks are extremely difficult to treat and actually drive you absolutely insane.
And you go through the whole mental gymnastics thing where you're trying to talk yourself into just just listening to them or trying to be patient with them and don't get upset. Just go along with them. Try to convince them. But man, it's hard on you. It's hard.
It is. It definitely is. It'll wear you down. Those folks are really, really difficult. And if I get rid of them, I will.
It is difficult.
They get upset. They can go. It doesn't bother me one bit.
Yeah, I think you're better off without patients like that if they're really belligerent about not wanting to do something that really is recommended, and they're just they know better than you.
Oh yeah. I had a situation once where I had a young person in, and she had a tooth that needed to come out. It wasn't severely infected, but it was coming out. And we took the x-ray, and I found out that she did not have a permanent tooth underneath it. So I told Mom, I says, look, I'm going to get her on antibiotics and pain medication. We're going to get her taken care of, and I need to have an orthodontist make a lingual holding arch that we're going to get ready to put in when I take that tooth out. Mom's like, oh, no. And she tries to just tell me all the reasons why we got to do this and that and this and the other. And it was kind of just dumb stuff. But I just had to tell Mom, look, we're going to have to agree to disagree. And you may have to go somewhere else if you don't trust my judgment on this. Because she just didn't trust what I was saying, And it was a simple thing. It was just like, look, she doesn't have a permanent tooth here. She's going to lose it. We're going to lose space if we don't do something. The child was like 9 years old. So it wasn't like, she was, in an adult stage. And, I just basically had to tell Mom a little bit bluntly that, well, we're going to have to agree to disagree. You don't agree with what I'm saying, so we'll go ahead and send you off to someone else that you can trust.
Mm-hmm. Yeah.
Yeah, that's the right answer, I think.
It's just the way it is sometimes, as hard as it is.
It's true, and it does suck to lose patience because, we've talked about this. It wears on you when you hear people say, well, I hate being here. When you say, how's your day going today? Well, it was fine until I got here. I mean, that we have a desire to be liked. And then when you're losing patience, it feels like a personal, shot at you. And that just wears on you mentally also, I think.
Mm-hmm.
Absolutely. One of my dental assistants had a patient. The first thing he said is, I hate to be here. I hate you people, kind of thing. And Marcus, you brought up a point one time, I think, maybe when we were just talking amongst ourselves, and said, if you're going into a surgeon and you're like, he's doing some microscopic procedure on you, something that's, needs to be done, you're kind of wanting him to do the best job possible. Is the first thing that you're going to say when he walks in the room is to tell him you hate him?
Yeah. That's really going to make him have good feelings towards you. Or
I think you had brought it up at one point. And said, wouldn't you just be just doing everything you could, like trying to make him happy and upbeat? Yeah, things are going to go good today because I want you to put a nice filling in or a crown or whatever it is. But no, they just tell you, I hate you.
Yeah.
Right off the bat.
It just puts you right
amazing.
in that great frame of mind that, I want to do my best for you. Not that you'll ever not do your best, but it just subliminally wears on you, and it makes it, you're more likely to want to get that patient out of there, so maybe you rush a little more than you would otherwise,
Exactly. Yep. But it does wear on you mentally big time.
Mm-hmm.
Yeah, it's totally true. So here's another type of patient, guys. What about the patient that comes in, and probably a new patient, they usually are these types, and they come in for, say, a toothache, and the first thing they tell your front office to tell you is like, well, I've got a toothache, but I don't have any money to pay for anything. Well, how do you guys handle that? Because I'm usually dumbfounded, and I think, well, I don't know what to do for you if you can't pay for the service I provide. I mean, you would never go to a mechanic and say, I've got a flat tire, I need new brake pads, but I can't pay for that. Go to the grocery store, I need some groceries, but I can't pay for it. Like, yeah. I don't know. How do you guys handle situations like that? What's your wordage when it comes to that?
Silence.
Crickets all around.
It depends on the situation you're in, because, like, Marcus, your clinic may deal with some of this stuff where people don't have money and they have you get government subsidies or something. Is that true?
Yeah, where I work at a community health clinic, we kind of expect that people are going to come in and maybe be low income, but we even have standards. At the most somebody's going to get is 50% off.
Okay, so it's not like they don't have to pay anything.
Right. So we basically, they have to verify that where their income's at. They have to show some pay stubs, or they have to, show you some proof that their financial situation is what it is. That's a little different in private practice. When I was in private practice, if somebody would have said, I'm really broke and that kind of thing, I don't know that I really had some great thing to do. I probably wouldn't have said, well, let me see, bring me some pay stubs and I'll decide if I can help you. I don't think you'd do that in private practice.
I refer them to the health clinics.
Yeah.
We have one. Luckily, I have one right across the street from my office, and so I say, you know what? Right over there, they have a graduated fee scale, and based on your income, depends on how much you're going to pay. It's going to be a lot less expensive for you over there. Go over there and get them to check it out. There have been times that they haven't told us until they're sitting in my chair already. They haven't said they got through the first line of screening, I guess you could say. And so, sometimes you just go to that conversation in the chair, or, every once in a while you do stuff and you just won't charge. But I'd say that's a rarity, because, somehow you still have to pay your staff. You still have to pay all of your bills.
Even in a community health clinic setting where I'm working now, most people that come in or maybe don't have a lot of money, I hate to stereotype, but most of them have some kind of resources, because they're coming in a car, they got some gas, they usually have a nice smartphone of some type that they're using, and so they have some resources. I think for a lot of people it's just an easy cop out, because they figure dentists are compassionate. They figure that somehow that we're in a service type profession that maybe we just do things for people for free. But our services have value. We have expenses, and I'm not saying that you shouldn't try to be charitable. And if you really feel it in your heart that somebody needs help, or somebody's circumstance somewhat, that you shouldn't give away some dentistry. That's all good. But for the most part, don't beat yourself up mentally thinking that you're a jerk because you just turned somebody away because they couldn't pay for the services that they needed.
No, and that's a good point. Yeah, you don't need to be a jerk, and you can explain to them there's financing options with Care Credit, or what other options are out there. Sometimes you can take some payments in your office. Sometimes we'll do take a credit card and just run that each month or every couple of weeks or something like that. And we talked before that how did it go, Troy? They don't care how much you know until they know how much you care.
Mm-hmm.
Yeah. And so if you're polite and you let them know you care and everything, and we'll work with them and help them out, usually they're a little more responsive and a little more willing to pay, it seems like, if they actually think you're caring about them and not just trying to get some money out of them.
Yeah, I think that's where having a good staff member that handles the finances. I think using that card. I mean, just saying, you know what, I do the treatment. I have somebody else on staff that manages the financial stuff, and so turning them over to that person, and then having that person be the type of person who can make the patient feel like they're trying to help them. They're saying, you know, look, here's some options. You can make payments. You know, we can do care credit. Do you have a family member in the area? That kind of thing. At least it makes the patient feel like, okay, they're trying to help me find a way to do this.
Yeah, I think that's a great point. Is don't let yourself as the dentist be the finance person. Let somebody else handle that in your office, because a lot of times I've had, people come back and try to appeal to my softer side and think that they can maybe manipulate me into discounting something or doing something for free. Or, if they tell me that they don't have any money and they just had to fix their car and this and that, I will, have a softening of my heart and won't charge them anything. But if you can separate yourself from that and just say, well, I just have the person in front handle that, it does make it a lot easier on you as a dentist, and it makes it mentally a lot easier also.
Boy, that's the truth, Ryder. What you said right there is true. I think sometimes they try and corner the dentist because they know that the dentist has a good heart. And when they get me in there, I sucker right into it.
Yeah,
it's true.
They start saying, I don't have any money and all this stuff, and I'm like, okay. So what I end up doing, you could bill for an X-ray, a focused oral eval, and a palliative or whatever treatment you end up doing. Oftentimes I'll just say, okay, fine, I'm only going to charge you for this filling. I'm not going to charge you for the focused eval or the X-ray.
Yeah.
And that's exactly what the patient wants you to do,
Yeah.
And I'm not saying you shouldn't do that. It needs to be limited, of course, because you really need to keep your revenue going. But, it's a fine balance, and it is a very, very mentally draining process to determine who actually needs help and who's trying to play you.
Yeah.
And that's the tricky part is like, I don't mind helping people that seriously need it, but boy, I do not like to be played. And that's the tricky part is who's trying to do that, to you. Because like Marcus said, sorry, I'm kind of talking a lot here on this topic, but
we like it. Keep talking.
These people drive in an Escalade.
Yeah.
Right.
And they got the latest and greatest phones, and they tell you, I can't afford this $200 for this stuff, and you're kind of like, what?
You're paying $600 a month for your car. No kidding, you can't.
Yeah. That's probably why. It's just like, well, it's not that you can't afford it. It's just you choose to use your money somewhere else, and you don't seem that the filling that I did has as much value as your cell phone or whatever, which is fine if that's the way it is. But don't tell us that you don't have money when you clearly have some sort of resources. You're not suffering too bad.
Do you guys ever trade with people? I mean, have you ever had people that
I've had people want to, but I won't do it.
Yeah,
I won't do it anymore either.
It's tended not to work out for me. I mean, it seems like my services are pretty direct and right in front of them, and it's quick and easy for me to give them to them. But most of the things that people want to trade, either I don't really need, or it's easy for them not to deliver the goods. So
yeah, I have a story about that. When my wife and I had been married 3-4 years or something like that, and we in our neighborhood we just moved into, this couple invited us over. They were a little bit younger than me, and he was a plumber, probably still is, I guess. And asked if we ever traded or anything, how it worked. If he needed some crowns or whatever, how would that work? And as far as buying supplies and things like that. And so we decided, which was stupid on my part, to trade. And so what he would usually do is call me on a Saturday and say, hey, I've got this tooth hurting me. Can you come in and see me? And I'd usually say, well, can we do it on Monday? His response was, well, I don't want to miss work on Monday, so I'd really like to do it today. Well, I don't work on Saturday, but what I would do is end up going in there. And then it ended up that I think the way the trade ended up is that he owed me about $1,300 after all was said and done. So I had this was after a couple of years that I hadn't seen him. We had moved, and I had my front office call him and ask how he wanted to take care of that. And he said, oh, I just thought that, whenever we needed something done, that we would just do it for each other for free. I'm thinking, no, that is not how a trade works. And So I've had people offer to do my taxes for me, to get me paintings for my office. And I just tell them in the nicest way possible that I usually don't do that. And, or that, I already have somebody to do my taxes and things like that. But that is a difficult time when somebody approaches you like that. It makes it kind of awkward.
Yep. What I do on this, I have one particular gentleman that is we've done not a trade, but when he approaches on it, he's an electrician, so we have him do the electrical work in the office when we have things go out, ballasts in the lights or whatever. And so what he'll do is we just have him bill us for what he would normally bill for that service, and he just takes that money and puts it on his account. So we don't actually write him a check; we just give him credit for the exact amount, and then we just bill out the exact amount that we do when we do the service. So we're both receiving full fee for everything. We find that that's the best way to do it, because then at least, you can't do like you guys are saying where, it's really one-sided. You end up dishing out $3,000 and get nothing in return, or you only get $1,500 worth of services in return for $3,000. So, that's the only way to do that. That gets really, really tricky.
It's a good point.
Someone always feels like they're getting burned.
Yeah, somebody always. It never ends up even.
Yeah. No, because to be honest with you, people put different value on different things.
Yep,
that's totally true.
A refrigerator repairman puts more value on what he does than the dentist, because we're too expensive.
Yeah.
His $65 fee that he charges to come in for 2 seconds and determine what my refrigerator's broken is not too much, because it's his time. So it's totally different.
Yeah.
Totally true. Yeah. And we just lost our refrigerator repair band listeners, but that's fine.
That's okay. I don't think we had a bunch of them.
We didn't have any anyway. All right, well, let's talk about new patients. This is a topic Troy had brought up, and this can go several ways. So we'll start with when the new patient comes in and you're trying to make a good impression. I mean, obviously you want them to like you want them to like your staff, but then sometimes things change when you get to diagnosing things and tell them that they have a cavity or cavities, and they were under the impression they didn't have any because the previous dentist never told them they had any cavities, and you can clearly see that there have been some that went undiagnosed. Troy, how do you handle that?
That is a tough one, because I actually had that happen to me this week. A young lady came in, and she even had the x-rays from the other dentist, and that's what I diagnosed most of the stuff off of. And and then you're sitting there in a situation where you are going through this thing in your head is, what is this woman or this patient going to think of me? Because I'm telling her that she has a bunch of cavities that her dentist that she just saw 6 months ago said that she didn't have, or, overlooked, or whatever it may be.
Yeah.
My office, we just tell them, say, look, this is what I'm showing. I bring up the x-rays on the computer screen. I show them and I say, these are cavities right here, here, here. I found that if you do that and you show them visually, they don't freak out as much. But boy, is it stressful. It's so stressful to see, something that somebody else didn't pick up on an x-ray or something. And, I'm not saying that I haven't missed stuff, but some of this stuff's pretty blatant. And, it's pretty stressful when it's the first time you've seen them. Never known them before, never heard anything about them, nothing. They don't know anything about you, and you come in and just give them all this horrible news right off the bat. That's a tough time.
Yeah, that is a tough time. And, I guess I would relate it to like if you had been taking your car into a mechanic for years and then went to another mechanic and then he says you need all this stuff. And my first reaction is to think, oh, he's just trying to make some money off me. He's just gouging me. And that's what I fear the patients are thinking also. And so I think that's great, is showing them on the x-ray the cavities on there. I mean, if they're usually visible on there, and then explaining to them that they need to have those done. If they choose to get the cavities filled, great. If they don't, well, they'll catch up with them, and then they'll have, root canals and things like that, and then they'll, wish they'd believed you. But Marcus, have you had any experience with that?
Yeah, along the same lines. It's just tough when you go in to see somebody new, because you want them to like you. You want to put on a good show. You want them to think, oh, this is a great office, and here you are telling them that they've got all these problems and they're going to need to owe you money. So that's always been a tough one for me, because I kind of like people to like me. I want to be liked, and so it's a really stressful thing. I need new patients. I want new patients, but I feel a lot of pressure, a lot of stress to give them hopefully good news, but obviously you can't, ignore things that are wrong. It's your job to tell them things that are wrong. So it's just a tough one. Some people I think are better than others. Some people are made up different, and it just isn't a struggle in their mind. But I think for a lot of dentists, that's kind of our nature, is we want to be liked, and it's hard to always be telling people tough things.
Yeah, and some people have that salesman personality, which really grates on me. But, some people are responsive to that, and I don't have that personality. I have to, try to be as honest with them as possible and show them things like Troy said. But what about when it's perio issues and they come in and they have, maybe severe periodontal disease, but they've been going to another dentist and all they're getting is, polished up and, just the regular cleaning in, quotation marks. Mm-hmm. And how do you show them periodontal disease?
Yep.
Marcus.
I do that.
Crickets again.
Troy, sorry.
Marcus took a deep breath, so I thought he was going to say something. He just sat there.
Just
I thought he was having a heart attack.
Yeah.
Turn the O2 up. I've had this happen. And you feel like you're a horrible. You're the bad guy because you have to tell them the bad news. The problem is the dentist that they were going to was the good guy, right? Because he never gave him any bad news. He's never told him he had periodontal disease. Man, he was the greatest dentist ever. Come over to you and you say, okay, well, you got 4 or 5 millimeter pockets. You've got a lot of bleeding. You've got some, exudate or whatever here. Let me show you this on the x-rays. See this little, the spicular calculus, whatever. You can show them that. But boy, I tell you what, that is a tough thing. It's the same thing as like the cavities, because most of the time, periodontal disease doesn't, it doesn't hurt anybody. You can't feel it. You don't know you've got it going on. It's asymptomatic. Even some smaller cavities, and even some larger ones. I had a teenage kid come in, had a bombed out tooth, and it never even bothered him. So different people have different levels of pain and what they feel and what they perceive. But that is the same situation where you are the bad guy by telling them exactly what they need, which is basically the truth. And the guy that didn't tell them is the good guy because he was the guy that didn't give them any bad news. But another thing, you have to take the high road. You have to tell them. And even if I lose the patient, if the patient says, I'm out of here, I'm leaving, that's fine. I don't have a problem with that because guess what? I told you what you needed, and if you choose to leave, that's your deal.
Yeah.
But I find that oftentimes they do trust you,
mm-hmm.
and then when they go to the other dentist and their newer dentist, the other dentist says the same dang thing you did, they end up back in your office because they find out you weren't trying to pull one over on them.
Yeah, that's very true. They do come back, and I have found out the same thing, Troy, that it can be kind of a tense conversation. You feel like crap when you're involved in it, but a lot of times they'll come back and they'll say that was the best cleaning they ever had or something like that, and it probably is. And at that point, you've won them over for life, probably. But it would be better just to excuse them if they decide not to go through with that. I did have kind of the opposite, I guess. I had one patient that went to a corporate dental office, and I hadn't seen him before. He came from the corporate dental office and said that the place had offered him the $600 cleaning or the $800 cleaning, but they recommended the $800 cleaning. And luckily his wife had been a dental assistant before, so she kind of started thinking, that seems kind of weird. Anyway, so I think their daughter was a patient of mine, so they came over and looked at him. He had quite a bit of recession, but no pocket depths over like 3 millimeters, no like heavy calculus, nothing. And and I'm trying to think, if it was a $600 cleaning or an $800 cleaning, there shouldn't be any in between. It's either you need a prophy or you need like some scaling and root planing, and it's not. I guess you get treated with what you need to have. If you need 4 quads of scaling and root planing, you get 4 quads. Yeah. You don't get the option of having 4 quads or 2 quads or 1 quad. It's all or nothing usually with something like that. Yeah,
I think sometimes we, in our effort to try to make it not so scary or hopefully not make them upset, we sometimes dumb down what we're telling them. And with perio especially, it's not just another type of cleaning. They've got a disease. It needs treated a certain way. It's not, just a $600 cleaning or whatever, however you want to phrase it. I get maybe where somebody would try to use that as an easier way to sell it, but I mean, yeah.
Yeah, you gotta tell it what it is. That's the thing. People will never have any legal standpoint on you if you're always telling them the truth.
Yeah.
You know?
Yeah, that's a good point.
You tell them they don't have cavities when they do, or you tell them they don't have perio when they do, and then they come back on you in a few years and say, you never told me this stuff, then you're in trouble. But if they leave your practice and get mad at you because you told them they had periodontal disease, and they go off to somewhere else and find out, oh, I did have it, you know, they don't have a leg to stand on, and you were being straight up and honest with them.
And you can sleep at night.
And you can sleep at night, and that's the most important thing in the world.
Yep. Yeah, it's totally true. Now let's talk about, speaking of legal deals, what about the patients that want you as the dentist to tell them what to do, and then they don't do it? I mean, legally, as far as I know, guys, is that we can't tell them what to do. We can advise them on treatment, maybe tell them what's a better treatment, but we can't tell them, you know, and I have a lot of patients come in, well, I got this partial done because the dentist told me I needed it. I got this bridge done because he said I needed it. I don't know why I needed it. He just said I needed it. Like, dentistry must have been easier back in the good old days, because I tell people they have an occlusal cavity and I have to go through 6 hours of explaining what that is. And it's like, well, it's mental gymnastics.
And why do they need it?
Yeah. So
it doesn't hurt me.
It doesn't hurt at all. So have you guys had that when they say, well, you know, and usually they're being very polite and they say, well, you're the expert, tell me what to do. And how do you handle that? Because we can't really tell them what to do. Troy? No. Go ahead.
We have to give them all the options and then let them choose. Oftentimes, if you know they ask me, you know, what would I do, or tell me what I do, I'd say, well, this is what I would do if it were my tooth, or if this was my wife's tooth or my mom's tooth, you know, whatever. This is what I would do.
But if it was my grandma's tooth, I'd do this. No,
Grandma is a different story. She's a little older, and so therefore, you know, I know. But you know, that's kind of that is the tricky thing, because you do have those patients that you'll sit down and you'll do that consultation and you'll go over everything with a fine-tooth comb. You've got all the details out. You've gone over every option possible. And they go, okay, what would you want to do? Okay, the implant. Okay, cool. And they'll come back and they'll say, nope, I want to do this. And you're like,
yeah,
okay, all right, whatever. You know, I mean, in the end, it is their choice. But, you know, that happens a lot, you know, even though we do give them our recommendation. You know, there are times that patients don't want to lose their teeth, and I can understand that. But there are times that when you're going, you know, I don't know if I can get a post in there that's going to last that maybe, you know, any length of time. And I think the best thing is to do a dental implant. So, you know, you can't lie to them, but you got to tell them, you know, there is an option for doing a post here. I don't think it's the best option, but we can try it. You know, but ultimately it's up to them to do it. But it's extremely frustrating when you have people that you have to talk to over and over and over, and they still don't listen to you.
Yeah.
And didn't you have something like that recently, Troy, where you had like somebody that you did several consults with? Three
consults. The guy had 2 teeth, number 29 and 30. Both of them needed endo buildups and crowns. Or he didn't want to do the endo buildup and crown because it was too expensive. You know, he just didn't want to spend a couple $1,000s a tooth. And so I says, well, the other option is, you know, take the teeth out. We could do a possible bridge here. We could do implants. And he kind of started leaning toward the implants and stuff. And so we went over everything. I started explaining, you know, implants, what's entailed. Next thing I know, he's back in my office asking me, what would you do, man? What would you do? 3 times I went over that. Yeah. And finally, he ended up just saying, I'm taking the teeth out and we're going to do a partial. So, you know, it's like, wow. You know, you just don't even know. You don't even know what's going to happen sometimes. You can just explain over and over and over.
Yeah, and that's true. And, you know, another type of patient that I was thinking about today is the one that comes in and they have like a broken tooth or a big filling, and you say it needs a crown. You know, we can build it up today. We can get it ready to where it's, you know, the hole is fixed or whatever, and get it ready so you can come back to have the crown prepped. And you tell them, you know, maybe you tell them at the next checkup, you need a crown on that. And then when that filling comes out, or, you know, that breaks off again or something like that, they come in and they want you to fill it again. but they want you to do it for free because you already did it and your filling didn't last. And that's frustrating to me because, I told you you needed a crown on that. Mm-hmm. And, they either conveniently forget that or, say that, you didn't tell them that. But how do you guys handle that when they come in and it might be, a month later after you told them you needed a crown ASAP? Marcus, how do you handle that when they expect you to put the filling back in for free?
I don't know. I mean, that's a tough one because there you go again. You're like, you want the patient to be happy. You don't want them to be upset. And clearly in their mind, they're thinking that somehow this should be for free. So if you tell them it's not, they might be upset. But at the same time, if you've told them and you've kept it in your notes, you've written in your notes that you told them what, they needed to do and they didn't choose to do it. I mean, I think for the most part, you just need to explain yourself and maybe refer to the notes and let them know that, I think sometimes there's patients that are just kind of hoping that if they just kind of ask for it to be redone, that you'll just do it. Yeah. But inside, they're really kind of expecting it's not going to be free, but they're just going to test it and see what you'll do.
Yeah.
I don't know. I have redone stuff that I probably shouldn't have. Worrying that I was going to lose a patient or have somebody upset. But for the most part, you just are way better off to just kind of make sure you've kept your notes. You've told people what they, what the consequences will be if they don't follow through with the treatment, and then let them know that, hey, there's a cost associated with me redoing that filling or whatever it is.
Yeah, and I've also had patients that I've done a filling on, and then they'll be eating like a bit of honey or a Tootsie Roll, and they pull the filling out, and then same thing, they want you to do it for free. And I'm thinking, I didn't eat that bit of honey, and I told you, don't eat anything sticky on that. Then they did, but then, it comes down to like, do you want to lose a patient over it, or, do you want to get your money? I mean, that's a tough time. I don't know, Troy, you had any story? Do you have any stories about that?
Yeah, same type of thing. I usually try, if I know that I'm doing a compromised treatment on them, I will make it very clear that this is not my best treatment. This is not my first choice of what to do here, And I will tell them flat out, like, for example, you guys know how hard it is to do like an MILF or DILF or something on an anterior tooth. Like you're saying, Ryder, they'll bite down on a bit of honey, Tootsie Roll, jerky, forks, try and open a pop bottle, or something with that filling, and that thing didn't last. And you're like, okay, well, I have it documented in the notes, and I talk to the patient. I say, look, this needs either a veneer, crown, whatever, and I will tell them flat out that I won't redo it, and if I do redo it, I will charge them. And I've had one person actually. It's kind of interesting. Over the last, we've been doing for 13 years or whatever, we had to redo it 3 or 4 times. And the one time it came off, I just said, do you realize that if you would have just done a crown on it at that first visit, you would have already paid for the thing.
Yeah.
And we haven't even done the crown yet, So
yeah.
Try and bringing that up to their attention is saying, you're spending $300-$400, $250. I don't know how much the thing is, but however much a filling is every time. If you just use that money, you get the crown paid off and be done with it and have a little bit longer,
yeah,
little deal. But, of course, they don't want to do that right off because, crowns are expensive.
Yeah, they are. They are expensive.
But it's a great service to for a tooth that's broken. I mean, it's a great service.
Yeah, and I think a lot of people, they'll, if you tell them, I don't know how long that filling's going to last, and if they break it off again, usually they'll come in and say, you told me that probably wouldn't last very long, so let's go ahead and do the crown now. Usually they kind of understand, but there are those people that just conveniently forget.
Yeah, it's selective hearing.
Yeah.
There's people that like that one gentleman I was talking about earlier. He swore that we had never gone over those options before. I'm like, dude, do you have dementia? I mean, I didn't say that to him, of course, but I'm like sitting here just like, this is impossible. I have another lady I'm battling with the same thing with a lower denture. I told her before we took all her teeth out that it's horrible. They are terrible. They don't fit. It's nothing more than a piece of plastic with teeth on it that sits on top of your gums. There's no suction. I mean, I tried to talk her out of it. And then now that she's had it, and she's like, yeah, this thing doesn't suction, and I'm like, yeah, it's exactly like I told you. I mean, you never said that.
Yeah.
I mean, I've got it documented in our chart notes and stuff, but, people hear what they want to hear, and you can sometimes talk to your blue in the face, and it's still just not enough.
Yeah, that's true.
Drives you crazy, doesn't it? I mean,
It does.
When you see those people on the schedule and you know exactly what they're coming in for, you're just like, oh, please, no.
Yeah. So the moral of the story is to document.
Yes.
I would say. Now, let's talk about something else that really gets at me. And this is, I don't think it's totally, I don't know, it's not illegal, but it's just like false advertising by other specialists. And what I mostly had in mind was the implant centers that promise teeth in one day, and you'll go home and, you'll land on a sandy beach and have hair blown or wind blowing through your hair and this beautiful new smile all in one day. I get patients asking me that all the time. Well, I just wish I could just get teeth done like they show on TV. Well, you can, but it's not a magic formula where you get your teeth all in one day and you're all perfect and brand new. And little do you know, it costs like $30,000. But it frustrates me because I feel like those type of advertisements do a disservice to dentistry, because they make, and I guess that's probably their goal, is to make it seem like what they do is better than what the common dentist does. But does that frustrate you guys, or am I like the only one? Because I could be the only one.
No, it frustrates me too. We have a group around here that advertises, that they do sleep dentistry and sleep your appointments away, and they make it sound like it's just so easy and it's so seamless, and it's just going to be that kind of stuff. Yeah, it drives you crazy, and plus it's frustrating because you know how hard you're working to take good care of people, and you know that dentistry can be difficult, and not all procedures go wonderfully, but you can kind of beat yourself up thinking, crap, why am I doing this? How am I going to possibly compete with that?
Yeah. Yeah, it's true. They have the corporate money to really put the advertising out, but I feel like pretty much any oral surgeon can help you do some sort of implant procedure where you're, getting a bunch of teeth in their mouth in one day, but it's, not usually a permanently cemented bridge all in one day, implant supported or anything. And that's what these implant centers are advertising, it seems like. So,
that's true.
Anyway,
the surgeons that I work with, we don't do anything same day. I mean, we do everything we want to do the best thing for the patient. We want to make sure that it lasts. There are certain implants that I wouldn't want to load day one.
Yeah.
I mean, do you want the thing to last, or do you want to have to go through that procedure over and over and over again, because it keeps falling out?
Yeah. Yeah. When I refer a patient for an implant, they're like, oh, it's kind of a long procedure. I wish I could just do it like on TV. Well, yeah. Do you want it done right, or do you want all those implants to strip out the first time you pull your implant supported denture out? And I've heard of that happening before. So
right.
There's a reason that we let the bone heal up for 3 or 4 months around that implant. It's not just to waste your time.
Mostly mini implants are talking about.
You know what? As far as I know, what they're doing is placing the implants and then giving you like an intermediate denture to put over that in the meantime. And then a lot of times have you come back to restore them with like some sort of fixed bridge.
So they're not loading the implants. They're just
I don't think so.
Right. And intermediate. Okay.
Right. As far as I know, but we'll probably get
to be putting on an implant day one.
Yeah, we'll get hate mail from all the implant centers now.
Oh, well.
But we'll take it.
Well, we had some people over in town here close by that were pulling some folks over because they were saying the $800 implants, and our surgeon charges a lot more than that. So they were heading over there, and come to find out they were mini implants.
Yeah,
they were putting mini implants in there, and we've had some success with mini implants. I don't do them anymore because, like you guys said, I've seen too many of them fail. It's just one of those things that the mini implants they have their place, but I've seen quite a few of them fail, and I don't like it when you charge good money for something to not see it last a good long time.
Yeah, they have their place, but it sounds like there's plenty of people that just are using them as an easy money making little scheme to get patients in. Yep.
A lot of people push them to. Sorry, I didn't mean to cut you off there. They push them to the limit, and they try and make them do something that you wouldn't ask a regular tooth to do, and that's kind of I've kind of thought about it. Don't ever ask something to do something you wouldn't ask a tooth to do, Don't ask an implant to support more than you would have a tooth support,
Yeah.
All that stuff.
When I exercise, I like to do that. I push my body to the limit of what a normal body can do.
Like one push-up?
Well, I mean, come on.
You could do
I could probably do like 5. All right. Let's talk about one of the most stressful things for us as general dentists, and we like to call it the composite gauntlet. And what we're talking about is when you have like a quadrant of fillings and you have, say, 28, 29, 30, 31. They all need like MODs or, a DO, MO, whatever. And you have and maybe you even go around the corner and do something on the canines and the incisors. But what is the most stressful part? Marcus, I'm going to start with you. What is the most stressful part when you run this composite gauntlet?
Oh man, I don't know if I could pick just like one thing about it. Before I even start, I'm worn out. Like mentally, I'm just thinking about all of the steps that I'm going to have to go through. I'm going to have to prep each one of those teeth. I'm going to have to use a round burr and get the decay. Then I'm going to have to control moisture because I'm doing a bunch of composites, and I'm going to have to either rubber dam or a bunch of cotton rolls and the wedges, the bands, there's so many steps to it. And to me, it just wears me out thinking about it. Right now, I think I'm having a panic attack just talking about it.
I think you just raised his blood pressure by asking him the question. Did you? I don't know if he's okay.
Oh my gosh.
I'm going to have to sit this one out, guys.
Marcus done.
I know. I like that term, though, the composite gauntlet.
I mean, that just totally describes exactly what it is.
It does.
And I think a lot of times, like, maybe I'm wrong, but I think I could prep 4 crowns in the same amount of time that it would take me to do like 4 MODs in one quadrant, or maybe you're even doing a half of the mouth and you're doing something on the upper teeth and the lower teeth at the same appointment. And man, you're right, Marcus, when you get all those wedges and bands and every bonding 6 different times, and it just wears on you.
Yeah. After I'm done with one of those, I feel like I should be done for the day, but that's usually like just one patient in a row of many more patients. Yeah,
and when I diagnosed, I had a patient recently, and he had cavities in all 4 quads, and luckily he was okay doing 1 quad at a time. But sometimes there'll be those people that want to do half of the mouth at a time, or they'll have like 4 cavities in each quadrant, and they'll want to do all of it at one time because they just don't want to come back. Like, good heavens, you got to think about like operator, I don't know, efficiency and wearing us out and everything. But I don't know, Troy, how do you feel about it?
I'm the same way. This is operator fatigue. The thing that's horrible is when you've had a really bad day, and then the last patient of the day is one of those.
Yeah.
4:00, you've got 20 surfaces of composite.
Yeah.
I mean, talk about go home and go into a coma.
And this is kind of a different subject, kind of. I mean, but that's where I've gotten more and more where I like the idea of having a block schedule where you have certain types of procedures you plan to do at different times of the day. Because sometimes that's crazy. Like you said, that's crazy. 4:00 comes around and you got like 8 composites to do on a patient, and you're mentally already drained from everything else you've done that day. And I think your quality of care, I know mine probably goes down a little bit when I'm trying to do a big, huge case like that at the end of the day.
Yeah, that's true. And another thing goes along with the same lines is that when you have kids, because when does mom want to bring the kids in? After school. When are you the most tired? Right then, after school. And then you got these little squirmy kids.
But they're tired too.
And they're tired. They don't want to be at the dentist. They want to be home playing with their friends. And, those little monsters salivate like champs, Trying to keep a composite dry on one of them bad boys.
Oh.
And so there you go. That's hence our term today, the mental gymnastics. That's what you play every single day. You just, you go home and you're exhausted. Not physically, but mentally.
Yeah.
It's true. Yeah. Well, guys, do we want to wrap it up right there with the composite gauntlet?
Yeah, I think that's perfect. The composite gauntlet.
Yeah.
We just coined that term.
Yep. Trademark.
#composite gauntlet.
Don't steal it. That's going to be our periodical magazine, the composite gauntlet.
Yes, I like it.
That's perfect. I like it. Marcus has got all these terms. Marcus came up with the mental gymnastics.
He did. I think he did the composite gauntlet. We're going to have some sort of, obstacle course for dentists, kind of like American Ninja, but we're going to call it the composite gauntlet, and all dentists can come compete in their khakis to see if they can make it through this gauntlet.
Their plaid shirt with a button-down collar.
Yes.
That is hilarious what you just said. We could have stations set up. So, like, the first one, you sit down, you do a quick, class 3 on number 8. Then you go sit down and you go, a DO on 29.
Oh.
And then you sit down and do like a root canal. And then you sit down and do a front crown prep. Oh my gosh, that would be phenomenal.
I think we're on to something
how
here.
fast you could do it.
ADA, American Dental Association, contact us. We'll set up a booth or several booths next year at the convention.
Yes.
We'll have some fun.
Yeah, dental Olympics. And the master of the composite gauntlet.
And the champion will get like a necklace made of freshly extracted teeth.
Oh.
Yeah.
Like
all right.
Yeah.
We are on to something.
Yeah.
Okay. Well, on that note, you guys have any closing remarks?
Well, don't forget to check us out on Twitter at Dental Realist. Send us your tweets. Check out the tweets that we send out. We've got a couple of books out there. They're best sellers on Amazon.com, or somewhere they're a bestseller anyway. You can find it on Amazon.com, the iBook store. We're also, where else are we?
Lulu.com.
Lulu, yes, Lulu.com. We have a Facebook page, Dental Realist. Send us any of your questions, comments, suggestions for topics you'd like us to discuss. dentalrealist@gmail.com.
Perfect. Troy, you have anything you want to add?
No, that's perfect. It was a good discussion tonight. I look forward to the next one already.
Okay, well, we appreciate you tuning in. This has been episode 16, and we will see you on episode 17 of the Dental Realist Podcast. Thanks for joining us.